Arthrofibrosis diagnosis. This video gives information about diagnosis of arthrofibrosis following knee replacement. The diagnosis of arthrofibrosis is mainly based on history and physical examination. The first step is excluding all the other possible causes of stiffness following knee replacement. Normally, the pain and inflammation settle down in 2 to 3 weeks after knee replacement. Arthrofibrosis is suspected when the normal pain and inflammation do not settle at expected time points. There are no lab tests available for routine use to diagnose arthrofibrosis. The knee X-rays may show soft tissue swelling and new bone formation in the soft tissues. The knee cap may be situated lower than its normal position. Ultrasound examination may show thickening of the knee capsule. CT or MRI scan may show thickening of the joint capsule and new bone formation in soft tissue. CT scan is better for evaluating the bone and the prosthesis. The MRI scan is better for evaluating the soft tissue structures. Bone scan may show diffusely increased uptake. Arthroscopy may be helpful in evaluating the location and severity of the scarring as well as treatment. Biopsy techniques would show abundance of scar forming cells. Only X-rays are used routinely in the diagnosis of arthrofibrosis. The other imaging techniques are not used routinely, but they may be useful in excluding other causes of stiffness following knee replacement.